Question number 1. Which antibody is specifically associated with lupus and not typically found in patients without the disease? Options. Option A. Anti-nuclear antibodies. B. Anti-double-stranded DNA antibody. C. Elevated ESR, that is erythrocyte sedimentation rate. Then C. Reactive protein. So here the right answer is option B. Anti-double-stranded DNA antibody. So the anti-double-stranded DNA antibody is a particular anti-nuclear antibody found in many patients with lupus and is not typically present in patients who do not have lupus. A positive anti-double-stranded DNA antibody that demonstrates the presence of autoantibodies, that is against the cell nuclei, which is common in lupus but can also occur in other autoimmune disorders. The CRP and ESR assess the inflammation and are not specific to lupus. Question number 2. During an assessment of a newborn, you note a loud continuous machinery like murmur at the left upper sternal border. You know this finding is typically associated with what congenital heart defect? Options. Option A. Truncus arteriosus. B. Aortic coarctation. C. Patent ductus arteriosus. And D. Tetralogy of Fallot. So here the right answer is option C. Patent ductus arteriosus. So one of the hallmark assessment finding of patent ductus arteriosus is a continuous machinery like murmur. So it can be noted at the left upper sternal border. The PDA is a congenital heart defect where the ductus arteriosus does not close after birth. So this will lead to an increase in pulmonary blood flow. Question number 3. A 32-year-old multi-para is admitted to the labor room after her initial examination reveals her cervix to be at 8 cm, completely effaced, and at 0 station. What phase of labor is she in? Options. Option A. Active phase. B. Latent phase. C. Expulsive phase. And D. Transitional phase. So here the right answer is option D. Transitional phase. So the transitional phase of labor typically occurs when the cervix dilates from 8 to 10 cm. So in this scenario, the client's cervix is already at 8 cm dilation, completely effaced and at 0 station, indicating that she is in the transitional phase of labor. During this phase, the contractions intensify, became more frequent and last longer for preparing the woman for the second stage of labor. That is nothing but the expulsive phase. Question number 4. A patient is diagnosed with hypertension. The physician prescribed beta blockers for the patient. As a nurse, you know that which medication below is a beta blocker. Options. Option A. Amlodipine. B. Captopril. C. Timolol. And D. Olmesartan. So here the right answer is option C. Timolol. So remember, most beta blockers ends in lol for their generic name. Timolol is often prescribed for open angle glaucoma in a drop form and in hypertension in an oral form. So the captopril is an AC inhibitor and amlodipine is a calcium channel blocker and olmesartan is a angiotensin II receptor blocker. Question number 5. Your patient is 6-month-old infant. Which development milestone, if not performed by the infant, should be further investigated? Options. Option A. Crawling. B. Rolling over from stomach to back. C. Using the pincer grasp. And D. Sitting up without help. So here the right answer is option B. Rolling over from stomach to back. So generally, most babies at 4 to 6 months should be able to roll over from their stomach to back. So it's important to remember babies develop at different rates. The other options are milestones for older infants. The general timeline including crawling at 7 to 10 months, sitting up without help in 8 to 9 months, and using pincer grasp in 9 to 10 months. Question number 6. A client is hospitalized for pelvic inflammatory disease. Which of the following nursing interventions would have priority? Options: option A, encourage oral fluids, B, administer cefotan intravenous, C, enforce bed rest, and D, remove intrauterine device if present. So here the right answer is option B, administer cefotan intravenous. So in pelvic inflammatory disease that is often caused by bacterial infections and prompt initiation of appropriately antibiotic therapy that is essential to prevent complications such as abscess formation, chronic pelvic pain and infertility. So while encouraging oral fluids, enforcing bed rest and addressing contraceptive methods like removing an intrauterine device, that may be important aspects of care for a client with PID. Administering antibiotic to treat the infection takes precedence to prevent further spread and complications. Question number 7. You are providing education to a patient with type 2 diabetes. Which target HbA1c value should be emphasized to the patient? Options: option A, greater than 7%, B, less than 10%, C, less than 7%, and D, less than 2%. So here the right answer is option C, less than 7%. A hemoglobin A1c test provides insight into a patient's average glucose levels over the past 2 to 3 months, assessing the amount of glucose attached to red blood cells, that is nothing but the hemoglobin on the RBC during this period. This target for the patients with type 2 diabetes is typically less than 7%. Question number 8. Which of the following should be the nurse's initial action immediately following the birth of the baby? Options: option A, aspirating mucus from the infant's nose and mouth, B, drying the infant to stabilize the infant's temperature, C, promoting parental bonding, and D, identifying the newborn. So here the right answer is option B, drying the infant to stabilize the infant's temperature. So drying the newborn helps to prevent heat loss and stabilize the infant's temperature, which is crucial for their well-being in the immediate postnatal period. So this action also stimulates the baby's breathing and circulation. After drying the baby, the nurse can proceed with another necessary actions such as clearing the airway, identifying the newborn and promoting parental bonding. Question number 9. Premenstrual syndrome has a constellation of possible symptoms. Which of the following would not be expected? Options: option A, abdominal bloating, B, weight loss, C, constipation, and D, breast tenderness. So here the right answer is option B, weight loss. The diagnosis of PMS relies on the patient's self-reporting of symptoms that are predictably cyclic in nature and of sufficient severity to interfere with a day normal clients. So common manifestations include abdominal bloating, weight gain, constipation, anxiety, breast tenderness, depression, cravings of sugar or salt, and irritability is mostly present. Question number 10. Which neurological condition arises from an autoimmune disease causing inflammation that result in scarring of myelin sheath in the CNS? Options: option A, multiple sclerosis, B, Parkinson's disease, C, Guillain-Barré syndrome, and D, myasthenia gravis. So here the right answer is option A, multiple sclerosis. So multiple sclerosis is an autoimmune disorder that causes the immune system to attack the myelin sheath in the CNS. It affects the nerve cells in the brain and the spinal cord, and this leads to many sensory and motor type problems. So remember that the multiple sclerosis is equal to myelin sheath. Question number 11. A 46-year-old non-pregnant morbidly obese woman presents with irregular period over the past 6 months. Which of the following represents the most appropriate initial management in this setting? Options: option A, oral contraceptives, B, endometrial ablation, C, dilation and curettage, and D, endometrial biopsy. So here the right answer is option D, endometrial biopsy. So any type of abnormal vaginal bleeding should raise the concern for hyperplasia or malignancy. This patient is at higher risk due to obesity endometrial biopsy should be the first step. The options hysteroscopy or D&C might be indicated if a diagnosis remains unclear. Either oral contraceptives or endometrial ablation may be appropriate afterwards.